All right, time to talk about another horrible bill being proposed by Republicans in the Florida State Legislature. Let's talk about Florida SB 254. And because it's Florida, it wasn't enough for us to ban gender-affirming care for youth. Oh, no. We had to take it so much further. And we'll have our sandhill cranes in the background because I've tried to record this 20,000 times. So not only will this ban any and all gender-affirming care, even therapy, and therapists specifically have to sign an affidavit that they don't provide gender-affirming care for youth and will not refer patients to anyone else for gender-affirming care, but we took it even further. Let's talk about adults. This codifies the recent policy that Medicaid will not cover any gender-affirming care or medications or treatments, nor will any state-funded health facilities cover any gender-affirming care for anyone of any age. And we took it even further because let's talk about custody. Say you have a child, and if the court deems that that child is at risk for being exposed to gender-affirming care or transitions or in a household that is for gender-affirming care, no. The states can take your child away. And say you have one parent who is loving and supportive and, following the science and the AMA and the American Academy of Pediatrics and trying to provide their child with gender-affirming care, and the other parent isn't and only wants to dead name them and refer to them as the sex that they were assigned at birth, well, the courts can come in and say, sorry, loving and supporting parent, you no longer have custody of your child. That's going to go to this asshole over here because they have the right way of thinking. Because we have to protect the children. And just to set the record straight, because there's so much fucking misinformation. Gender-affirming care for youth is not sexual reassignment surgery. No, those two are not the same thing. Gender-affirming care covers a wide range of therapies, treatments, counselings, medical interventions, and surgery is usually the very last step and only used in extreme cases when it comes to youth. Most of the time, counseling is the first step, and maybe they might do some blood work, check some hormone levels, see what's going on there. But surgery is not happening on youth. Very, very, very rarely is this ever done. I would encourage you to go look up the American Academy of Pediatrics guidelines for gender-affirming care for youth. It's an amazing resource. They have tons of science-based evidence showing that this saves youth lives, and this will kill people.